Hi, I'm Dr. Mel, and I would like to talk about the medical emergency condition of Milers Ocampo. I'm sure everyone knows her. She is a popular Filipina actress, model, writer, and singer. She began her career in show business at a young age and has since become one of the most talented and sought-after actresses of her generation. Last month, she had a medical emergency. And now, let's hear her medical history.
Nagkaroon ka ng medical emergency last month. Anong nangyari?
Nagkaroon po ako ng emergency. Yung parang lagi pong hapong-hapo. Tapos yung feeling na parang laging may nakasakal sa akin. Tapos hingalin po ako, nilalamig ako bigla, or bigla akong naiinitan. So sabi ko parang may thyroid po. But at that time, hindi siya hypo. Hindi rin siya hyper. So,
from the signs and symptoms that Milers experienced, I do agree that she has a possible thyroid problem. She has both signs of hyperthyroidism or hypothyroidism. If you want to know the signs and symptoms of hyperthyroidism in contrast to hypothyroidism, then here's an easy way to remember. Hyperthyroidism occurs when there is too much thyroid hormone in the blood, and we're going to have symptoms speeding things up, like increase in heart rate, palpitations, diarrhea, anxiety, insomnia, irritability, tremors, nervousness, weight loss, and heat intolerance. In contrast to hyperthyroidism, in hypothyroidism, it's just the opposite. There will be a decrease in the heart rate. Instead of diarrhea, there will be constipation. Instead of weight loss, there will be weight gain. Milers mentioned that she would develop weight gain even if she looks at her diet. And cold intolerance.
ang next step was, alright, pa-ultrasound natin.
After her blood test to check for abnormal thyroid function, ultrasound was done to look for any nodules or abnormalities in her thyroid gland. Next, biopsy was done to determine if any cells in the thyroid gland are cancerous. Unfortunately, the biopsy results showed papillary thyroid cancer. Papillary thyroid cancer is a type of thyroid cancer that arises from the follicular cells in the thyroid gland. It is the most common type of thyroid cancer, accounting for around 80% of all cases. Papillary thyroid cancer typically grows slowly and has a high cure rate when treated early. The treatment of papillary thyroid cancer depends on the size and stage of the cancer, as well as the patient's overall health. The treatment options include: number 1, surgery. Surgery is the most common treatment for papillary thyroid cancer, and depending on the size and location of the cancer, the surgeon may remove part or all of the thyroid gland. After surgery, radioactive iodine therapy may be used to kill any remaining cancer cells. Papillary thyroid cancer patients will also receive hormone replacement therapy. Since the thyroid gland produces hormones that regulate metabolism, patients who have had their thyroid gland removed will need to take a synthetic thyroid hormone for the rest of their lives. Luckily, Milers Ocampo had a successful surgery and will undergo other treatments mentioned. And you might ask, Milers is very young, so beautiful. How come? Where did she get that thyroid cancer? Actually, the exact cause of papillary thyroid cancer is unknown, but there are several risk factors associated with the development of this disease. This includes age. Papillary thyroid cancer is most commonly diagnosed in people between the ages of 30 and 50. Milers is actually 25 years old, and she falls a little bit below this age group. Papillary thyroid cancer is more common in women than in men. When there is exposure to radiation, especially during childhood, then this is also a known risk factor for papillary thyroid cancer. For the case of Milers Ocampo, I think she did not have any history of exposure to radiation during childhood, or there is any history of thyroid cancer in the family. So, the exact cause was not identified in the case of Milers Ocampo, just like my dear daughter, Dr. Tobia Mariel, who was diagnosed to have gastric cancer. In the future, I also plan to discuss about the diagnosis of my daughter, gastric cancer, and how she coped with it. So, watch out for it. How about prevention? Is there a way that we can also prevent papillary thyroid cancer? There is no known way to prevent papillary thyroid cancer, but there are several things we can do to reduce our risk of developing this disease by limiting our exposure to radiation, especially during childhood. Another is to perform regularly self-examination of our neck. We should also seek medical attention if we notice any lumps or abnormalities in our neck. And the last but not the least is to always maintain a healthy diet and lifestyle. And lastly, I want to talk about prognosis. The prognosis for papillary thyroid cancer is generally very good. The 5-year survival rate for papillary thyroid cancer is around 98%. And I have heard of many patients living many years after being diagnosed of papillary thyroid cancer. However, as with any cancer, early detection is key to successful treatment. What I can say, Miles, you are very lucky. Your cancer has a good prognosis. If we could only choose the type of cancer that develops in our body. Yes, my daughter Dr. Tobia Mariel has an aggressive gastric cancer. Before I cry, I have to end this video. Thank you for watching. If you learned something from this video, please subscribe, like, and share.